Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Wohler, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Hi, everybody. Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Wohler. And today we're joined by Barry Bruder, who is the co-founder and CEO of IASIS, I hope I pronounced that right, Barry, Technologies, which is a company that is dedicated to the science and use of something called microcurrent neurofeedback. So I'm really interested in this topic. I think you're going to find this information very helpful. So Barry, welcome to the program.
Thanks, Dr. Wohler. And it's very, very close. It's IASIS, like I assist you, minus the T. It's funny, though, because people in Texas, we have a lot of practitioners in Texas, and they call it IASIS, like they're going to hitch their horse up to it. So it's IASIS.
Excellent.
Microcurrent neurofeedback. Absolutely. And I'm honored to be here with you and happy to answer some questions and just help to illuminate a little bit more about the technology, the history, where I come from, how the heck I got to developing this, and where we are, maybe a little about the science if folks are interested in that, and where we kind of see it going forward in our challenging times.
Well, it's definitely challenging times, and Barry, my experience with neurofeedback was very positive going back many years ago. So when I was actually practicing in California, particularly in San Diego, I had a colleague who had a pretty severe brain injury. In fact, I believe he was one of the first who had actually undergone what I guess is considered to be traditional neurofeedback back in the day. And I don't remember who developed the technology, but it transformed his life and his ability to practice again. And as time went on, I started using neurofeedback with select people in my patient base, some autistic kids, some individuals with ADHD, and it was helpful. But what I found with the traditional neurofeedback was, although it was helpful in some individuals who could go through it, there were those who had a difficulty going through because it was a number of sessions. Many of the autistic kids, they couldn't sit in front of the computer. And so it was hit or miss. And I knew that it was very helpful if we could find the right person. And one of the things that intrigues me about the microcurrent and what you're doing is the less sessions that are needed. It's more passive, as opposed with the traditional neurofeedback, from my understanding, having to try to manipulate things on a computer screen. So give us a little background about how, first off, you got started in interest in this field, the mission of your company, and then we'll get in more to the nuts and bolts of the different aspects of microcurrent neurofeedback.
Absolutely. So my background is I have been working in nonprofit, for quite a few years. My background is I'm a chaplain, and that came about in March of '88. I realized that for me, the spiritual aspect of it, and I don't focus so much and don't want folks to, get the idea that this is, focused in a specific religious direction. It's not. It is, I say, multi-denominational. It's basically just, kind of from the notion that I believe that we're here to be loving, love one another, be kind to one another. And if we can find something that can help to improve the quality of life, that's really where I come from. I just want to be in service and be helpful in terms of doing what I believe that we're here to do. I look at it like, to whom much is given, much is expected. And I don't care to retire at ever, anytime. I want to just keep with whatever breath I have helping folks. And that said, I was running a nonprofit for women and children with HIV/AIDS called the Safe Place for Pediatric AIDS in Los Angeles, sending kids where ostracism was a big deal during that time when they didn't realize that the viral load was so small if a kid bit another kid, that it wasn't problematic. One thing led to another. I met Dr. Joe Church, who was the head of allergy and infectious disease at Children's Hospital. And I said, Dr. Church, I founded this nonprofit to help spread the word that these children, they need a safe place to go to. That's why it was called the Safe Place for Pediatric AIDS. And we wound up with 6 different preschools that were willing to take the kids in. One thing led to another. There was a conference, and Dr. Elizabeth Kubler-Ross was there, who is known as the brilliant doctor and teacher, Swiss German, who brought forward the stages of grieving. And when I told her about the safe place, she invited me to train with her. And as time went on in working with all these families, finally ostracism wasn't as much of an issue. And I turned the nonprofit into Clear Path Addiction Care to work with folks with addiction and so on and so forth. And about 15 years ago, so we're in 23 now, so about 15 years ago, I was going through some challenges, just like we all do. And I turned to a friend, Hyla Cass, who's a biomolecular psychiatrist, which means she likes nutraceuticals versus pharmaceuticals, prefers them. And I told her I'd lost my mom. I was going through various challenges. And she said, well, you ought to try this LENS neurofeedback. And I said, LENS, low energy neurofeedback system. And I said, whoa, wait a second. Stick electrodes on my head? No, I don't think so. There, yeah. Shut up and go stick electrodes on your head, or take this Lexapro. Well, I'd like to try the electrodes first, I suppose. So, okay, went to the doc, had a session of LENS, would admit that not then, but 3 months later, finally admitted that I perceived a diminishing of anxiety in a big way. But being in a place that I was in, I turned to the doc and said, I think this is a placebo and I don't buy it. And he laughed, and I didn't, because I'm really not a joker. If something's funny, it's not because I meant it to be funny. And I went back for 3 months, and after 3 months, I said, Doc, I think this is real. And he said, well, it took you long enough. And I said, well, I'm a very skeptical guy. And at 6 months, I said, okay, I must do this. He and his wife bought me a LENS system. I went and trained with Len Oakes, who was the founder of LENS, Low Energy Neurofeedback System. And I started working with people. And after about 2 months, observing quite a bit of reaction that followed the sessions. I would call one of my mentors and say, hey, this seems like this person's having a lot of reactivity. And, which is like exacerbation of a symptom, a little too tired, wired, spacey, this sort of thing, right?
Were you primarily working with people at that time who were also dealing with some mental health challenges, and anxiety or stress, or
at that particular time, Dr. Wohler, I was in Los Angeles, living with my wife and kids in Santa Monica, and I was treating a lot of military, first responders, a lot of veterans with suicidality, anxiety, depression, PTSD, a lot of addiction, because I worked as part of aftercare for certain, I won't mention the names, but certain kind of, fancy schmancy recovery centers, which there's like a zillion of in Malibu. And I won't give any plugs. And I was seeing, and also quite a bit of kiddos on the spectrum, ASD, autism spectrum disorder children, and a lot of insomnia, a lot of garden variety anxiety and depression. And what I began to notice early on in my own private work with it was that there was a lot of reactivity. And I turned to my wife and I said, Laura, what if there's something out there that can help people to get to what I call the kind of the leading edge of enduring sustainability, but in a fraction of the number of sessions? And she went, oh my gosh, not another mission. And I said, but wait, I have to do this because I feel called to do this. And she said, yeah, you feel called to do a lot of things, and you're never going to rest. And I said, well, as long as I have breath, you're right. So I started searching, and I literally searched the world over, by, computer and phone. And I just read everything I could. And when I couldn't find what I was looking for, I suppose I had the naivete to think, well, gosh, if I surround myself with some very brilliant electrical engineers, software engineers, and so forth, perhaps we can take what we know, find out why we're having all this reactivity, and come up with something that's a little bit more helpful, but that can work in a fraction of the number of sessions to get to enduring sustainability, but with diminished occurrence of reactivity.
Now, when you're mentioning reactivity, so how are you defining that? Because I mean, reactivity could be they're having a positive response. Usually, though, in medicine or something, I mean, it depends, right? It's variable, but reactivity is often given sort of a negative connotation. So,
right.
So in your phraseology of reactivity at that time, what did that mean for a typical individual you were working with?
Right. Great question. So if somebody comes in and they say, oh, wow, I had such a great reaction to that, I say, hold on, that's a reaction to my environment. You had a positive response. So if a person, now there's a lot of dichotomies and a lot of contradictions in this work. So follow this, check this out. If a person has reactivity, it may look like tired, wired, spacey, headache, nausea, or the exacerbation of a symptom. And these are all the things that we might refer to as reactivity. Now, here's the dichotomy and the contradictory part. I remember early on, one of the first days that I was working on my own, and this person had a lot of reactivity. A little bit of head pressure, tired, sleepless that night, just reactivity. And anxious and exacerbation of some of the symptoms. And I called my mentor and he said, good. And I said, what? How was that good? The person had a reaction. There, a subset of every reaction is a response. And a subset of every response can be a reaction, but you knocked her off the fence. The technology helped nudge her off the fence. Now she's not stuck in what now today Dr. Stephen Porges refers to as dorsal vagal freeze in his book Polyvagal Theory, which I highly recommend that people who are interested in the brain look at Dr. Porges, who is the bee's knees of docs in this arena, in my estimation. And so what we noticed was that my observation of working with individuals, the fewer site pairs, right, when we have two active electrodes, because we have a pair that go preauricular that are what we call the receivers. They're reading the information, right? And then we have a ground on the back of the neck. So we call these reference. We have a ground, we have two active leads. As we're moving those leads, they go to different locations on the head, and that's how we mediate doing a session, not all over the head. And that's the key to what I learned 15 years ago. As I started working with the technology and seeing all this reactivity, I thought to myself, well, what if I did 2 less site pairs? What if I did 3 less site pairs? And I kept doing hundreds and hundreds of sessions, going down in the number of site pairs. And what do you think I found? When I got to 3 site pairs, 3 different locations, that was the golden ticket to causing the least occurrence of reactivity with the greatest occurrence of positive outcomes that people were recognizing and communicating in their 24-hour observation report, self-observation report. So out of empirically working with it and doing fewer and fewer and fewer pairs, I found that I was able to achieve greater outcomes, what I call responses, that became more enduringly sustainable over time because it's very cumulative. So what I do today creates the platform for each session to become a little longer, a little longer, a little longer. So that gives you just a little bit of the nuts and bolts of how we began. But I've got to tell you, I was very reticent to go out and talk about it because, let's face it, in our country, Dr. Wohler, if you don't have science, you're just a nice person with a nice idea. And I reached out to a gentleman who was a doc, a brain surgeon, and he loved IASIS. I used it with his child on the autism spectrum. And he said, you need to see this Marine. He's a 30-year retired master gunnery sergeant. And he's had migraines for 5 years since he got blown up in his Humvee and so forth. And I think that that would be a really, really smart step for you to take. And so what I'd like to do is put you with him. I did a session for this guy. The next morning, I received a telephone call from him. Scared the heck out of me, Dr. Wohler. He said, Bruder, sir, what did you do to me? I said, okay, you're scaring the heck out of me. Are you okay? He said, I have awakened at 2:14 a.m. every day for 5 years since I was blown up in my Humvee. I have been drinking 36 to 48 beers a day.
Wow.
And I just did the dishes with my wife. And I want to know, what did you do? Because I want more. And this became the norm for what I observed. But the beauty of it is that that doctor introduced me to Dr. Mingchong Huang, and Dr. Huang, Huang, who at the time was the director of the resonance imaging lab, still is at this time here in, November, coming up on November of 23, the resonance imaging lab at the University of California at San Diego. And he said, I think we can do a study on this for a mild to moderate traumatic brain injury. And I said, but we're just a small mom and pop group at this point. This was in 2013. And he said, well, I think that I can get the university to donate the use of the MEG and MRI, MEG magnetic encephalograph, and the MRI. And we were off and running. And don't you know, Dr. Wohler, every person, including Dr. Huang, they donated their time for that study, which published in September of 2017, with overwhelming evidence that IASIS helped tremendously with diminishing the impact of mild to moderate traumatic brain injury, as well as many of the symptoms of PTSD. And then my saying, if you don't have science, you're just a nice person. Finally, we had some teeth that we could sink into it. And I felt, for the first time, comfortable to go out and begin, albeit slowly, softly, because I don't really want to be a moving target for pharma or anything. I never say a disparaging word about anybody or anything. I wouldn't be alive if it wasn't for pharma with heart issues and different things. And I think that we can all play in the same sandbox.
So before we go, let's go back and give the audience a little bit of idea about what is neurofeedback, what is it doing? So
Sure.
It's interesting because the individual I knew had a traumatic brain injury. And so the early neurofeedback, in fact, my understanding was they actually are helping to bring people out of comas. So explain the difference, because you're talking about, you have 3 points of contact, you're starting to kind of work that out. Obviously, you've worked over time to try to minimize the point of contacts and accentuate, the effect, and then minimize the sessions. So real briefly, a traditional neurofeedback setup, how does it work, and what's expected of the individual? And then what you're doing through your technology, the microcurrent. And then let's get into some of the nuts and bolts about what it's doing physiologically in the brain, the autonomic nervous system. So let's start there. So give us a little background, or just a brief overview on what is neurofeedback doing, traditional versus microcurrent in the setup.
Perfect. So the first thing that I think is helpful for practitioners, doctors, to identify is if I'm working with, let's just say, an increasing population of individuals with a pretty significant amount of anxiety, depression, PTSD, suicidality, we don't have 30 to 60 sessions for someone who is threatening to eat a bullet or hang from the bedroom closet. We have today. And it was really, I guess I'll preface talking about what is the difference between bioneurofeedback and IASIS microcurrent neurofeedback by saying that when I learned of the numbers of suicides of our brave men and women that were returning from the Gulf War, from following that with what was going on in Afghanistan and Iraq, and all of the the issues that were happening in the Middle East, with the incredible statistic daily, which went from 20 something now into the high 40s of reported suicides daily. It was so heartbreaking for me. I couldn't stand it. And it was truly from that motivation and standpoint that I decided that I really needed to do something to hopefully help to make a difference. That said, when I started looking into traditional, what I call granddaddy biofeedback, neurofeedback, that's been around for almost 50 years, with early work with cats, Barry Sternman, UCLA, all the way through Sue and Siegfried Othmer, creating the Signet system, which is an incredible system. But the thing is, I don't have 6 months to train to learn about every area of the brain, which is required in the classic form of bioneurofeedback. They learn, those individuals who study in that arena, they study all the different areas of the brain, and they require what is called a Q, EEG, Q for quantitative, EEG, electroencephalograph, which shows areas in the brain where there is hypo or hyper functioning of the brain, any kind of an issue for individuals who are working with bioneurofeedback of that earlier classic biofeedback, that the traditional neurofeedback, they rely on that knowledge in order to choose which areas of the brain to treat. And keep in mind, it's a good 30 to 60 sessions. Whereas with IASIS, it doesn't take 6 months to learn how to use the technology. It takes 2 days online. It takes 2 days in person of a foundational training, and people are off and running and working with the technology. And it does not require a quantitative EEG, nor does it require knowledge of which area of the brain does it need to go, because we are fairly equidistantly bathing the brain in a tiny micropulse of energy. And that micropulse of energy is approximately 3 trillionths of a watt. It's considered to be about 150 millivolts for 120 nanoseconds. To give you a perspective, Dr. Wohler, it's such a small energy that it literally, according to Dr. Mingxiang Huang from UCSD, said that it takes a $500,000 piece of equipment to see energy that small. It's almost incomprehensible how it can even be effective, but for the fact that we know from the research that I'll touch on later exactly how impactful this technology can be. So the other really important aspect.
Real quick, so is traditional neurofeedback something that is energy being added to the system? So essentially, microcurrent, right? You're adding a very small percentage of wattage, essentially, to an individual that's having a physiological effect. Is traditional neurofeedback something different? Is it trying to add more, or is it attempting? Is the individual my understanding was traditional neurofeedback, the individual themselves was actively involved in coordinating things off a computer screen, which is why it was very difficult for autistic kids.
Yes, and now you're getting yes, and now you're getting into the aspect that I was kind of moving toward, which is granddaddy traditional neurofeedback, which is often referred to as operant conditioning. Who's the operator? The person sitting in front of the computer. We're reconditioning. How do we do that? Because they're playing a game on the computer where the balloons are flying by, or whatever the element is that is part of that particular software program. And as they focus on those elements and shoot down the balloons or help to keep the clouds from rolling by fast and slow them down, it's been found that they're actually, by their own conditioning and choosing and focusing, slowing their heart rate and their respiratory rate. Hence, operant conditioning. And no, it isn't sending any kind of energy. It is reading the information.
Right.
And it is giving that information to the computer, which is helping guide the operator, but it is not actually affecting an actual change to the brain. Whereas ISS is, in fact, sending, albeit extremely minute, approximately a millionth of a cell phone. Because I'll have people say, oh, I don't know, electrodes. And I go, ever go like this with your phone? Yeah. Okay. It's 1/1,000,000th of a cell phone. That's how powerful a cell phone is. People don't feel anything from ISIS. There's nothing to feel except the reports of feeling better, diminished anxiety, depression, et cetera, et cetera, et cetera. So the bottom line is ISIS is a passive approach. You don't have to be or say or do anything. We put on the electrodes, we move them from one pairing location to another, and a session may take anywhere from 15 to 30 minutes from the time you come in till the time you go out. And then patients and clients will complete a 24-hour observation report through the ISIS app, which is on the Android, Google Store, and the Apple Store, ISIS application. And there's no cost. They're able to use that so that they can submit a report, and it helps the practitioner track how they're doing and what they're noticing. It's all about what they're noticing ultimately. Right. So the biggest difference between traditional and ISIS is that Dr. Mingxiang Huang has used the phrase LIPTUS, low intensity pulses using transcranial electrical stim, albeit very, very, very tiny and minute, but that is the biggest difference. And of course, the time that it takes I know this sounds hard to kind of get one's mind around. 85 to 90% of the individuals or greater report after the first session a positive response ranging from, I feel calmer, notice the question, I'm questioning myself, to, oh my gosh, my anxiety went from an 8 to a 2, 10 being the worst and 0 being none. Like 85 to 90% of people telling us that their anxiety is diminished in the first or second session. And I'll tell you more about the research that supports that a little bit later. But I think what would be helpful now that we really kind of identified some of the differences, I'd like to speak to the mechanism of action and what we suspect and what we know. Okay. About actually what we call the mechanism of action and how it is what we call mediating the effects of what IASIS is actually doing. So the way that I talk about what IASIS is doing, and the scientists have shared it with me, like Dr. Huang, is that it's actually a bifurcation. So there's two separate sort of threads of how I describe what IASIS is actually doing. And we know this because of the mental health study and the study from the University of California at San Diego that published in September of 17 for mild to moderate traumatic brain injury. On the first leg, what is happening is that it is elevating what we call parasympathetic tone. So if I lift muscle, weights for my muscles, I'm increasing my muscle tone. It's been found to increase parasympathetic tone. And in our nervous system, the parasympathetic is more of the chill. It's the brake. And the sympathetic, that I call sometimes the not so sympathetic, that's the gas pedal. That's fight or flight. Get me out of here. Ouch. Right? The stove is hot. So it is simultaneously increasing parasympathetic tone, coming down fight or flight, and helping to assuage, tone down what Dr. Stephen Porges refers to as dorsal vagal freeze. So it's diminishing the being stuck in some of that sympathetic dorsal vagal freeze, calming down fight or flight, not taking it away. We don't want to take away our ability to run if we got to run. But if we're stuck in that mode, that's not helpful or skillful. And we're increasing parasympathetic tone, creating and bringing about auto neuroregulation. That is the first thread. And the second thread, Dr. Ming-Chong Huang identified that IASIS is, in his words, firing up cholinergic pathways, sending more cholinesterase to the brain, bypassing the blood-brain barrier. And when that occurs, we know that cholinesterase is very instrumentally helpful with the detox function in the brain. To be specific, from here down, we've got the lymphatic system. But from here up in the brain, we have the glymphatic system. And that cholinesterase is actually firing up the little itty bitty cells that comprise the glymphatic system, called little itty bitty glia. The glial, G-L-I-A-L, cells that bind to excess metabolic waste in the brain, helping to perform metabolic clearance, which means helping the brain heal itself. I don't think that IASIS heals people. I don't heal people. I heal me with God's help, but I'm not healing anybody. Sheer hubris to think IASIS is healing people's brain. I don't buy it. I believe that the brain has a brilliance far exceeding what we know and may not know for a while. In fact, many people over time, 10, 15, 3, 5 years, if they have a traumatic brain injury, I've learned from all of the neurosurgeons and specialists, the brain heals itself largely. But if somebody has been in proximity, which sadly is the case for many people who have been over in the Middle East, they're exposed to as many as 8 to 10 bomb blasts, and they have 8 to 10 concussions. Now, what a lot of people don't know, there's a helmet that they can put on, and it's actually an MRI helmet that they have on the front lines that they can use to determine that that individual has a bleed, that they have a mild to moderate traumatic brain injury. Ramstein, home, you're out of here, right? Because now they know. And 1, 2, 3, you're out. No more of this 8, 9, 10 concussion business, which is crazy. And so we are bringing about autoneuroregulation. We are performing metabolic clearance, helping the brain to rid itself. But there's one more very, very important piece, not to get too deep into the science, but this is very important that I know that your viewers will appreciate and find interesting and can Google more information about it, that I find fascinating. If an individual, Dr. Wohler, has prolonged trauma, year after year, being in a war zone, bombs are falling. Think about what's happening in our world, in the Middle East today, and over many, many years of abuse, whatever the trauma may be, right? When trauma is allowed to go on unchecked, not dealt with, it literally floods the brain repeatedly with all these neurochemicals, homocysteine, cortisol, adrenaline, noradrenaline, et cetera, right? All these stress chemicals. And it does not go without impact. Those prolonged floodings of the brain actually cause axonal injury and damage. And you remember from your anatomy and biology, the axons and the dendrites, how there is communication between neurons, and that becomes damaged, right? And the ability for the brain to read what's going on neurologically in the body, and the body to understand neurologically what's going on in the brain, is called afferentation. But when I get a boom, and then another, deafferentation occurs. And it's the lack of the ability of the brain to be able to communicate effectively with the body, and the whole system isn't functioning all that well. IASIS, we know, is increasing that parasympathetic tone, helping for that to become more of the norm, calming down the fight or flight, helping to detox the brain. And many people are aware we don't just manufacture all these neurotransmitters in our head. We manufacture them in the head, in our heart, and in our gut, which today is often called our second brain, not just in our head. So we know we are increasing the production of all these helpful neurotransmitters to create more balance and regulation in the gut, heart, and head. And this, in a nutshell, is the mechanism of action and how IASIS is actually able to function not in 30 to 60 sessions, but that it is absolutely effectively changing the brain to help it heal itself even in the first session.
So very interesting, a couple things. One is the improvement in cholinergic activity and through glymphatic activity. So we know that glymphatics are a major part for helping to remove toxins from the brain, which is why proper sleep is so important, because glymphatics is very active in sleep. And so it's like removing sludge, right? It's a waste product. You're trying to get things to, so the cells in the brain can function more effectively. And that could be the areas of the brain regarding language or comprehension or executive function. So it really depends, or just a global effect. The other thing I think is interesting is that through the modulation of glymphatics and the removal of these excess substances that get produced either externally or internally in the brain, or can cross the blood-brain barrier, and then downregulation of microglia. We know that microglia is a very important immune cell in the brain, and it often gets activated by substances either internally or that can cross the blood-brain barrier and trigger its activation. So microglia activation is a major trigger, we know, for inflammation. In autism, they've actually measured increased activity of microglia, even astroglia activity. And so I can see this whole scenario of you've got compounds that can generate triggering of inflammation triggering oxidative reactions triggering cell damage, and then the expression of internal contents of cells that we know can send their own danger signals, for example, that could just end up causing neurochemical dysregulation. So it might manifest as anxiety, it might manifest as depression, it might manifest as insomnia. Downstream, it could lead, as you know, to dementia. And all of these other neurodegenerative aspects. So the way I think of the technology that you're discussing with microcurrent, it isn't a disorder specific type of thing. It has a global biochemical physiological supportive effect and influence, and which is why these types of therapies, even going back traditional neurofeedback, for example, they can have a global effect. They're not making a promise that they will cure anything. They're assisting in normal function or attempting to remove certain barriers for normal function to occur. And that's a beautiful thing in these types of therapies. So, let's go through, a few scenarios, because I was looking on your website. I know about traumatic brain injury, and of course that could be veterans, that could be people with other head injuries, for certainly beneficial. What let's say, for example, I want to touch on first. Let's go to the spectrum. First, I want to touch on a typical parent with an autistic child, right? What might they expect? Again, we're not talking about absolute cures or miracles here, but what might they expect just from the standpoint of a couple sessions? And then let's go to the other spectrum. Not that autism and dementia are a spectrum, but I'm talking more in age, really, in anything like kids and adults. And then let's look at something like an adult with dementia. So first off, in the autism population, which is where a lot of my work has been, what attracts me to this is the ease of use and the ability to help decrease anxiety, stress, which can lead to impulsive behavior, aggressive behavior. So what's been your experience there?
So there are three cases that really come to mind that I think are very important to show you the full gamut. And I'll go through these rather quickly. The first, mom brought 5-year-old Romeo in, and she came in, and she, young mom, and she said, I can't get Romeo to sit still. I don't know how you're going to be able to do this. I don't know. You're not going to, just, very, very anxious. And I said, look, we'll just give one session a shot. We'll see how we do. He sat still. I recommended that she show him a little cartoon. And sometimes I'll say, bring in the dinosaur, big, thick cardboard books. They'll look through, just something to keep their attention and their focus, right? And unless you have an atomic child, and I'll touch on that in my second scenario. And we finished the session. It took about 15 minutes. They were in and out in 15 minutes, that first session. The mom called me the next day and said, Bear, Romeo said, Mama. And I said, okay, that's that unusual? He's never said a word. 5-year-old child, one session, and he said, Mama. And she burst into tears and was saying, I'm so grateful. I've had fathers tell me, my son looked me in the eye. He's never looked me in the eye. Okay, now I'm going to go to the second scenario. I was working in Santa Monica at the time in the office of my buddy, Hans Gruen. And I was going back and forth from Temecula, where I live, near San Diego, to Santa Monica and seeing patients for about 11 years. And in came Nadine and Charles with Christian and Christopher. Okay. Christopher was an atomic child. Let me explain. The father had to hold him on his lap with his leg around his legs, holding his arms because he wouldn't have any part of it. I had to hold the electrodes on the child's head, or they would have fallen off, and it was like a bucking bronco kind of a situation. And I explained, I said, now look, guys, this is not for the faint of heart. The only way you're going to be able to help him to see that this does not hurt is by doing it a couple times. And we're probably going to have to do it 2 or 3 times before he just gets it and calms down. I think that I had the electrodes on there for about 90 seconds. And I said, okay, we're done. And he said, the dad said, we're done. I said, yeah, we're not going to traumatize. That's enough. They came in the next time, and I was able to keep the electrodes on by holding them on the whole time. The difference is Charles was able to let go, and Christopher sat on his lap, watching himself surfing in the ocean off Malibu. He came in the next week. Dr. Wohler, I met them at the front door to the office. Christopher reached up and took my hand, walked me to my office, pushed me into my chair, sat on my lap, and started punching the keys on the computer. We did the session, and I'm sure as much work as you do with these kiddos that are so precious on the spectrum, that you know that oftentimes they have an iPad that has buttons for each word. And I was treating Christian, who sat like a little angel the whole time, didn't have to be on anybody's lap. And while I was treating, and this was the third session, while I was treating Christian, Nadine started crying and said, oh my gosh. And she came over and she showed me this little iPad. And because I tell people that I'm Bear. And so the little boy touched the picture of a bear, makes feel better. And they were in complete shock that he actually pushed this. I couldn't believe that he did that. And every single time that they came in, probably for about 18 sessions, it was easy breezy. He sat in the chair. He didn't have to be in anybody's lap. It was pretty touching. And now I'll tell you about the third case, and that will give you more of a solid understanding of the actual sort of benefits that I perceive are actually happening. Clearly, Broca's area, where the language is in the brain, it's in there. But I was talking to a neurosurgeon in Mumbai, in India, about a month or 2 ago, and he said, I am convinced that the reason IASIS works is that it's repurposing molecules. And I said, can you explain that a little more? He said, sure. Broca's area is there. It's helping to reteach or teach for the first time the tongue, the lips, the mouth, the jaw, the larynx, how to work in conjunction with the language area. How else was Romeo able to say mama and never said a word? How did that happen? I'm certainly not going to say how I think it happened. I'm listening to experts tell me why they think it happened. Okay, so for the last 6 months, once a week, I have been working with and doing sessions with Quentin. When he first came in, his legs would be bouncing up and down, just, moving all around, doing a lot of stemming, kind of doing this thing where he would punch his arm into the air, kind of getting energy that was stuck in his body as if to be clearing some of this out. Over a period of about 2 months, the dad reported to me that, and we're talking about a 18-year-old, and reported to me that Quentin, and this never happened, he sleeps through the night. He never slept through the night. Never slept through the night. He would always get up and go in and find his mom and pull his mom over, and they would snuggle, and he would sleep for a couple hours. He sleeps through the night. He no longer keeps himself locked in his room playing whatever video things or whatever it is that he's doing, listening to music or different things or watching cartoons or whatever he's doing. He's now downstairs in the den where the TV is, and there may be people in the room or not, but he stays in a central location, which shows a comfort level, not only in his body to be able to sleep for the first time through the night for months now, but also socially, he's interacting. He wants to be around the family. And whereas he was very, very oppositional, defiant in school, the teachers have said, what in the world are you doing with Quentin? He's just not being so oppositional. He would see something, he felt like he had to pick it up, clean it up, whatever. And like one time on the bus, he wanted to help but it kind of put him in danger because he's getting up on a bus. And now they're not seeing that. And he's about to do another IEP shortly to assess, where he is, report. And I'm sure that it's going to be very, very different. So the comfort in their body, the diminishing, because remember, this is diminishing anxiety and depression. The interesting thing is that it's helping connect things better in the brain, and they're able to articulate themselves better. And whereas before, he may have just kind of gone along with what he was told to do, he's a little bit more willing to say, I don't want to do that. He'll say, no, I don't want to do that. I want to do this instead. And I think that it takes a very special teacher to identify part of what's coming out of IASIS is that the brain is more effectively, highly optimally functioning. And for a kiddo on the spectrum, we need to respect that the child is probably more present and tuned in the room.
The one thing I've recognized is these kids are very intelligent. They're very aware, and they're not much gets by them. So as far as situational awareness, environmental awareness, but that also because of just the dysregulation within the nervous system, coordination of the different parts of the brain. Interesting thing about Broca speech, I've recognized that for many years too. It's like those pathways are there, but they just can't quite make it happen. And then all of a sudden things start to connect. So that's very interesting. Let's shift over to real quickly on dementia. I mean, that obviously that's something that evolves over time. And then I want to ask you a few more questions before we wrap things up. But so the other, I'm not making the claim that autism is a straight line to dementia. I'm looking at this as autism is generally at this point in time mostly young kids. Dementia is mostly older adults. So that's where I'm going with this. Your experience in individuals with dementia, now that is in itself can be its own spectrum. So I already can understand some of the mechanisms at play. If we just go back and think about our discussion on lymphatics, cholinergic accentuation, etc. So, do you have a particular experience or a case that is?
Yeah, I do. I actually do, and I've seen this in several instances. And the other thing that I think is important to mention is stroke. But before I go to stroke, which is a different brain issue, in a way, we have different dysfunction. So where, for example, here in Temecula, a lady brought her mom in, and what she found was that after a number of about 8 to 12 sessions, the language and the recollection of language, she reported, increased significantly. The amount of oppositional defiance decreased significantly, like by 30 to 50%. And overall, she found that there was an interactive quality that had not existed for about 4 or 5 years. In the case of my father-in-law, my wife Laura's dad, when he had Lewy body dementia, which is lesions in the brain, that disease can cause an actual shrinking of brain matter, and parts of the brain actually die. It's a very, very harrowing, very sad situation. And obviously a little bit different from typical dementia, Alzheimer's, but similarities cross over, and by no means am I an expert in this arena or a doctor. But what I will tell you, by working in my experience of working on my wife Laura's dad, because I treated him 3 days in a row when we were in Lexington. And on the first day, instead of saying a few words and then drifting off, he was actually able to stay in the moment and finish his sentences. After the second day, he was actually remembering, Dr. Wohler, names of individuals that he hadn't said in a few years. And by the third day, we were driving in the car somewhere, and I said, Laura, did you hear what your dad just said? That was all logic. He had to be able to complete X plus Y equals Z to be able to make that distinction. So the changes that I have seen, the earlier the better, folks, because if someone is, in the 12th hour and there's no functionality, it's not going to expand in a Lewy body dementia situation, the brain back out to where it was. It's not like a balloon that we can blow back out when tissue dies. But I have seen a great deal of support, particularly, I often say this, Dr. Wohler, IASIS is not the be all end all, but it's one heck of a spoke on the wheel. And when in conjunction with something along the lines of Dr. Dan Gutenau's plasmalogens, oils for the brain that help to protect and detox, along with what Dietrich Klinghardt thinks is so important, chlorella as a binder that binds to metabolic waste, chlorella, CHLORELLA, to help with detoxing the brain, which Dr. Dietrich Klinghardt believes is so important for helping to detox, a binder that helps in that regard. I have found across the board that it can be very helpful. The thing to remember about working with memory issues and IASIS, remember that too much too soon can exacerbate a symptom. So we want to err on the side of, we're already micro, but now we're even going more micro. How? If a typical exposure, turn it on, it's 20 seconds long. Exposure to the ISS signal. I call it the signal. Instead of being the full 20 seconds, we watch the timer and we do it for 5 seconds. And we do 5-second exposures instead of 20 seconds. So we dial back the amount of time and we do a more micro dose. As my doctor friend, Dr. Frank Schallenberger, often says, there's no such thing as good and bad substances, only good and bad dosages. Now, I don't mean that crack is a good substance, but to his point, dosage is a very, very important, maybe one of the most important elements. So ISIS, along with for trauma, EMDR, movement desensitization, reprocessing, emotional freedom technique, with certain supplements like plasmalogens, things like this. I think that that nutraceuticals, nutritional support, along with ISIS, along with being alive in the body and getting the exercise and enough water and all that stuff, I think that ISIS can be a very, very helpful spoke on the wheel. And the final piece, and then we'll go to your next point, because I want to make sure to mention this because it is so significant in terms of brain and change, positive change, and response that we've observed in the brain. There's a woman named Marsha Moran, Moran, and she wrote a book called Stroke Forward. In her book, Marsha, who went to one of our practitioners, Brett Fuller. Brett Fuller is in the D.C. area, Washington, D.C., in Virginia. And she had, I believe it was 16 sessions, twice a week for 8 weeks. And I said, were you doing a whole lot of other things at that time? No, I was not. What happened? Now, I believe what she's telling me. She put it in her book. You can look her book up, Marsha Moran. She said, one side of my body was about 95% paralyzed. It diminished that paralysis over the twice a week of ISIS with Dr. Fuller in 8 weeks to about 10%. And I said, so let me be clear. You're saying that one side of your body was 95% impacted and not functioning, and that went from 95% not functioning to 10% not functioning in twice a week for 8 weeks, 16 sessions?
It's pretty impressive. Yeah.
That's true. And so I share that because I have a gentleman I'm working with now, and I'll just say real briefly, he was barely shuffling and walking into the office the first time that I saw him. He could barely speak. Now he's able to speak. He was drooling with a towel in his mouth. He's able to take it out. He doesn't need it anymore. He's speaking. He's articulating. I understand him. He wasn't able to do any food or water except for a feeding tube. He's now drinking water, and he's walking at a normal gait. And that's after 3 months. I mean, the things that we see are just kind of a little bit almost, I almost can't believe it. If I didn't see it for myself, frankly, Dr. Waller, I don't know if I'd believe it.
Well, one thing, Barry, the point that you made, it's very rarely one particular therapy that is the catalyst for overcoming challenges, particularly when things are complex. Something that's acute, maybe early onset, you could maybe make the claim. It's difficult, but obviously it's a synergistic effect of various things. But to the point, right? The microcurrent is resetting the framework for things to move. I like the way that neurosurgeon in Mumbai mentioned it's moving molecules or whatever he's
repurposing. He said. It's repurposing and re-educating. And I just went,
wow.
That's
a great way of putting it. So
right?
The repurposing aspect. So it's very interesting. Real quickly, Barry, any that people should know about any specific contraindications to microcurrent? Pacemakers, somebody who has epilepsy, for example? I'm assuming not, but I just wanted to ask.
There are no side effects. There are only well effects. And I have to say that in, almost 13 years of IASIS being in existence, there are no negative outcome effects that have been reported. Thank God. And I mean, how many things can we say? There are adverse reaction reports that have gone to the FDA 1,000 billion zillion times about so many different things. There's never once been an adverse reaction report of IASIS, and may it, God willing, never be. But there are no side effects. There are only well effects, and that's what people report. And I would like to make sure to mention when it's I think an appropriate moment to do so, about the most recent study that published in early September, when you'd like.
Well, go ahead and do that now, because we're just about done. We're going to wrap things up, but go ahead and mention that.
Sure.
And I just want to finish up with, how can people contact you? I'll bring up your website.
Sure.
So tell us about the study.
Thank you so much. I think it's really important to mention, because what I held the intention for and really kind of prayed on would be that we would eventually have a mental health study. Gloria and Gary Duke. Gloria sat on the IRB, the Institutional Review Board for the University of Texas in East Texas and Tyler, for a number of years. She's an RN PhD. And Gloria and Gary, they decided that they wanted to do a study on IASIS for anxiety, depression, and post-traumatic stress. And they did. And they believed so strongly in what they observed from the technology that they self-funded, and they invested a lot into the research. And the outcome is now published in the Journal of the American Association of Nurse Practitioners, the journey for the American Association of Nurse Practitioners. And the results are a P, or an outcome, right, probability, a P of 95. And for those that may not really quite get what that means, it means 950 times out of 1,000, it is always going to do X. And X was found to be 1 to 2 standard deviations above the mean of diminished anxiety, depression, and symptoms of PTSD. And let me put that in perspective for you. If we're talking about mental health, 1 standard deviation above the mean is a highly intelligent individual. 2 standard deviations above the mean for IQ is genius. IASIS was found to be helpful 1 to 2 standard deviations above the mean for its effectiveness of diminished anxiety, depression, and PTSD.
And how many sessions, by the way, was that?
20.
20. That's awesome. Well, Barry, it's been very, very interesting. So how can people get in touch with you? I know that you do trainings. You also have I believe, a clinic. I'm going to bring your website up here real quick. But I think I have to share my screen, of course. So
absolutely. While you're doing that, I will share that, folks, if you go to our website, which is, as you can see up top, microcurrentneurofeedback.com, microcurrentneurofeedback.com, there is, as you can probably see to the right, provider support. And then in the words above, find a provider that you're now pointing at, where an individual under find a provider, note to the left where that you were just at, if you click on find a provider, you can enter in your, and scroll down a tiny bit, you can actually enter your zip code, and it will show you the nearest individual to you. So you can do that. You can also reach out directly to me at Barry Bruder, Barry, Bruder, Bruder, at iasistech.com, IASIS. You can see the logo there, IASIS, tech like tech support, TECH.com. Barry Bruder, Barry, Bruder, at iasistech.com. You're welcome to write me, and I'll call you back. We don't actually show preferences for which of our practitioners, and we have them all over the United States. And you can look there, you can contact the practitioners, and they will be happy to see you and give you an experience of your own. And folks are also welcome to, I have a dedicated telephone number that folks can call if they want specific information about obtaining, if they should be doctors or practitioners wanting to learn how to learn about training and so on and so forth. There is
I was going to mention you actually have a section, I believe, on your site, training right here.
Yep, there's information about training. Okay. And you can also call the following phone number, and that is 310-562-5588. 310-562-5588, and leave a message or a text, and that will go through to me, and I will reach back out and help you to learn how to have a system acquisition, how to get a system in your hand as a tool in your medicine bag to help folks. So, Dr. Wooler, I just want to thank you enormously for the privilege of being with you and talking with your audience and sharing.
Well, it's been my pleasure, Barry. Very interesting, and I'll make sure we'll get this information out. I'll get all that contact information, by the way, and put it in the tagline when this particular interview posts, so people can just access it right online. So, thanks again. It's been my pleasure. I appreciate it very much. Thanks for joining us.
Very honored. Thank you.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Wooler. For more information about this podcast, go to functionalmedicinedoctalk.com.